21 years.
Crying out for bone marrow donors. And later in the show, warnings of a tidal wave of cancer. This is Checkpoint, and I'm Nkepile Mabuse. Welcome to Checkpoint, coming to you from the Netcare Pretoria East Academic Hospital, home to the biggest stem cell unit in Africa. Stem cell or bone marrow transplantation is a procedure that is most often recommended as a treatment option for people living with leukemia. Sadly, in South Africa, there's a critical shortage of black donors.
You just do this.
5-year-old Zavile Nkatu from Cape Town was diagnosed with aplastic anemia at the age of 2. His bone marrow doesn't produce enough new red blood cells, making him vulnerable to infections and uncontrolled bleeding.
I was breastfeeding him, but I was using the bottle also. So he kept on crying. But when he cries, I noticed there was some blood coming out of his mouth. And when we checked, there was a hole.
Zavile's mother was told her son's only hope was a bone marrow transplant, but it took 3 long years to find a donor. Amazingly, the match came from abroad, from someone who'd registered with the international database of bone marrow donors.
They called us February this year, and they told us the transplant is going to be done now. Part of me was happy, and a part of me was, because there's this thing of he might make it, he might not make it.
And so a glimmer of hope for Zavile and an end to his visits to hospital.
Is it nice in the hospital? And then my dad was there, and then my friend came there, my new one, but Daniel was there. So we can play Toit and then make me feel better.
But good health didn't come cheap for this little boy. The Nkatu family needed to raise 350,000 rand to access and administer the life-saving bone marrow. Their medical aid paid a portion towards Zavile's international donor. The rest the family had to raise.
You felt like the world had shattered on you. And you felt like you failed him, you failed your baby. How can you collect that kind of money in a short period of time? There is no way, especially when only one parent is working. But thank God I have a very supportive husband. He was there every step of the way.
The black American donor was a perfect match, and Zavile received his bone marrow 6 months ago at the Registry Hospital in Cape Town. But sadly, many children are not lucky enough to find such funding, or the perfect match. 7-year-old Sipiwo Jan lives down the road from Zavile and Khayelitsha on the Cape Flats. He has myelodysplasia, a condition where the blood and bone have abnormal cells.
Then you understand, you know, usphiwo uyithatha phi i-cancer because apha endlini akho umuntu une-cancer. Waxela kugqirha uba ushota ngegazi usphiwo.
Mom Tamara stays at home full-time to care for his son.
Usphiwo uqalwe yi-cancer ena 3 months gqirha wandixelela nge-cancer kaSphiwo ne ndaba rongo.
Mhlawumbe igqiba 21 years ukuba i-cancer kuthiwa iyabulala.
They visit the Red Cross Children's Hospital 3 times a week for chemotherapy, which leaves Sipiwo exhausted. A bone marrow transplant is all that will save her son. But there just aren't enough local donors, even though it requires just a simple donation of blood.
Abantu abamnyama ngithetha nabo ne bayatsho bathi no man iya kusangoma sitya amayeza esiXhosa. So bendicela ke abantwana abamnyama baphe abantwana abane-cancer igazi nomongo.
Generally, black people need black donors, but experts say there's not enough awareness about bone marrow donation.
If you want certain tissue groups, they're more likely to occur in the black population than in pale white.
The South African Bone Marrow Registry is based at Groote Hospital and is the brainchild of Professor Ernette Toit. She began the non-profit organization 23 years ago.
Organization has not had much publicity in the past, and we are perhaps not so well known that we do all this work. And it's so important that people realize the dedication in this organization to find a match and to provide a chance for a life for somebody who would be probably dead within a year or two.
Bone marrow life may be just beyond our borders.
Right now in South Africa, there are around 67,000 South African donors on our registry. But chances of finding a match for a patient are 1 in 100,000. So to improve our chances of finding a matching donor for all our patients, registries around the world work together and pool their donors so that worldwide there are 24 million donors. And what you can see here is the various countries that we have worked with. You'll see here in Germany, we've had 146 donors from Germany that the staff at the Bone Marrow Registry have identified as perfect matching donors for South African patients.
When we have to get stem cells from America, we pay everything at dollar rate.
A staff of only a dozen caters for the entire African continent. At an international bone marrow conference held in Cape Town last week, experts put their heads together to begin a second registry elsewhere in Africa.
There was some move to start a registry in Nigeria, but I think they haven't got more than about 500 donors. Patients who, at the moment, who need a stem cell transplantation from anywhere in Africa, they come here to Cape Town.
For now, it's up to the South African Bone Marrow Registry to find perfect donor matches worldwide. A parent, for instance, can't be a match for their own child because the child's DNA is split between both parents. A sibling is often the best match, but Zavile's sister Onika wasn't. Singer Zolani Mahola from the music group Freshly Ground is trying to raise awareness among potential bone marrow donors.
I had a very intimate view of somebody who was losing strength, losing power because of this disorder. It was a no-brainer for me. You know, I knew that I had to speak up and to become a part.
Thanks to an international donor, Zavile got to live a normal life.
See, you must listen to me now. Yeah. You will know me everything.
But for Sipiwe, it's a waiting game. The shortage of local black bone marrow donors makes his chances of a match even slimmer.
A lack of resources, staff and surgeons make treating childhood leukemia in South Africa difficult. Often the only hope for youngsters is a bone marrow transplant. But black patients need black donors, and that's easier said than done.
This is one of our patients' rooms. He's a young boy waiting for a bone marrow transplant. Our patient has a very low immune system, so we put up masks just to protect him from any infection. So Master Chidi has acute leukemia, and he's been treated before, and unfortunately his disease has come back recently, about 4 months ago. And now we have been able to successfully treat the leukemia again, but he's now waiting for a stem cell transplant.
I live in Mamelodi. My favorite sport is soccer.
And when the doctors explained that you had leukemia, did you know what that was?
Yes,
What is leukemia?
it's cancer.
Clinical haematologist Dr. Jackie Thomson heads up the cellular therapy unit at Netcare in Pretoria East. Once the bone marrow registry finds a match, they send it to her for transplantation. They harvest stem cells here too.
Fortunately, in South Africa, we have done some of the first transplants. We've always been world leaders, but unfortunately, due to human resource and infrastructure, we are not able to keep up with the demand of the transplants.
One of the reasons people are reluctant to donate is a lack of knowledge about the procedure. But it's actually a fairly simple one, not unlike giving blood.
The machine pulls the blood, it goes through the chambers, and then it comes into this chamber, which we call the centrifuge, where the blood is going at a very high speed, and that separates the blood into layers. And the machine collects the layer in which the stem cells are into this little device, which then in the end ends up in a little bag, and this bag will then be taken for processing to the processing laboratory. It's a bag of stem cells that's been cryopreserved previously.
Then it's off to the processing room.
When you work with them, they have to be managed very carefully so that they don't get any infection, that you don't introduce any infection into the cells, because otherwise the cells will die. He's just preparing the food that needs to go with the cells, so that when the cells get frozen, they need food and they need something to protect them, which is called a cryoprotectant, so that they don't die at that temperature, at that very, very low temperature. And that part of the process is the most important part. Because if you lose the stem cells, then obviously the procedure would not be successful.
All the rooms are hyperfiltrated to prevent contamination. For Tiego, it's another long wait. He's been in hospital for over 2 months. With a steady decline in the number of people of colour donating bone marrow, South Africa is reaching a crisis point. Advanced technology in the UK makes it possible for a simple injection to cure leukemia. But it's not an option here. Too few resources, prohibitive costs, and limited staff capable of carrying out this specialized treatment.
So worldwide, people are working on immune therapies to kill cancer. So they are actually designing little cells that seize cancer cells as foreign and go in and kill those cancer cells. And for us, we need to develop our laboratories to get to that level, because these kinds of treatments will be very expensive for people in Africa.
If you're sick, just trust in God and be quiet. They should donate to people, because some people are sick and some people don't like, maybe they will die or something.
Is that your biggest fear?
Yeah.